Are you surrounded by people who like to drink? Are you worried you may be at risk for developing an alcohol addiction? Do you have a family history of alcohol or drug abuse? We are here to help. With our SNP chip test, we can analyze your DNA to see if you have an increased genetic factor in developing alcoholism. You may be wondering what alcoholism is exactly. Alcoholism is a disease which affects many people all around the world. It is characterized by compulsive alcohol use, loss of control over drinking habits, and a negative emotional state when not drinking. There are several genetic factors which could make you susceptible to developing this disease. According to 23andMe, the genetic factor for alcoholism is between 38% and 64%. Environmental factors and lifestyle choices have a variable effect on individuals. Some of the genetic variations that influence alcoholism are caused by SNPs. SNP stands for single nucleotide polymorphism, which is the most common type of genetic variation among humans. A SNP is a change in a single nucleotide in a gene. Due to the genetic factor in alcoholism, we have developed a SNP chip test to help you know if you are more likely to develop alcoholism. Our SNP chip will test 12 genes that are likely to increase chances of alcoholism. Of these genes, two of the most important SNPs are RS27072 and RS1799971. Both genes affect neural pathways which have been cited in the current psychiatry reports to contribute to the vulnerability of substance abuse. RS27072 is part of the SLC6A3 gene, which codes for the dopamine transporter. People with the TT homogeneous genotype or the CT heterogeneous genotype are less likely to suffer seizures when going through alcohol withdrawal. People of the CC genotype are twice as likely to experience severe alcohol withdrawal. RS1799971 is part of the OPRM1 gene. It codes for an opioid receptor. The normal genotype is AA, but people with the AG genotype have stronger cravings for alcohol. If someone has the GG genotype, they will experience even more pain when craving alcohol. These findings were supported in a study researching the association of alcoholism in adolescents. Within the study, 51.9% of youths with an alcohol use disorder carried at least one copy of the G allele when compared to 16.3% of the control group who did not have an alcohol use disorder. However, there are some limitations to this test. While we can provide you with the information on your increased or decreased chances of alcoholism, we cannot control the environmental factors which can contribute to this disease. In addition, testing for alcoholism can put an emotional weight on a person who may feel the need to stop drinking in order to avoid developing the disease, as life choices are a large factor in the likelihood of developing alcoholism. Additionally, there are limitations to the accuracy of genetic testing for alcoholism, and there is some emotional turmoil that may come along with being tested. According to a study by the University of Sydney, subjects who were told they tested positive for gene variations that increased the likelihood of alcoholism felt discouraged from making positive life choices to reduce risk and felt emotionally negative. It was reported that this was because subjects felt fatalistic, as if they had no control over their drinking and would certainly develop alcoholism. Genetic testing is not always completely accurate, and alcoholism depends largely on environmental factors and lifestyle choices separate from family and genetic history. Our SNP chip test can help you find out if you have the genetic variations that put you more at risk for developing alcoholism. Contact us today to be tested and to get to know your genes better.